Hi, my name is Deidre Muirhead, and I am the Community Health Education Manager at YWCA South Florida for the Family Wellness Program. We welcome you to Wellness Wednesdays, where we demystify health conditions that affect minority populations. I am pleased to have with me today Ms. Bobbie Janjua and Mr. Jose Taque from Florida International University, Herbert Wertheim College of Medicine, the Department of Psychiatry and Behavioral Health. For today's topic, we will be learning about mental health. Ms. Janjua is licensed in mental health counseling and marriage and family therapy. She has experience providing individual, couples, group, and family therapy for all ages. She has experience working with patients diagnosed with mental health conditions such as mood disorder, depression, trauma, anxiety, stress management, and adjustment disorder. Mr. Taque is a licensed clinician with experience providing individual, couples, group, and family therapy for all ages. He has worked with patients diagnosed with mental health conditions such as depression, trauma, anxiety, suicidality, and adjustment disorder. Thank you both for joining us today. I'm really excited to talk about mental health to help normalize it and educate the community.
Thanks for having us. Pleasure to be here.
So we're gonna jump right into these questions. So how would you define mental health?
I would say mental health is about a person's emotional, psychological, and social well-being. It's how we think about things, we feel about them, how we act. Our mental health enables us to cope with all of life's daily problems, the day-to-day stressors, and it also helps us learn and adapt to new situations.
What causes a mental health problem, or what do you think causes?
Well, I mean, it could be a lot of things, from the situations that somebody lives daily to traumas, situations that happen across nations, across communities. There's so many different causes for mental health problems, and at the same in the same way, there's so many different solutions or ways to try and address the problems that come.
Leads me to my next question. With there being so many things that can cause it, what can prevent mental health problems, or is there something that can prevent it?
I think that there isn't just one specific way of preventing mental health issues. We have to take care of ourselves, decrease stressors, learn to cope with them in healthy ways, focus on our own resilience, develop our sense of hope and positivity generally for the future. And again, focus on that self-care, which is really important.
And how can someone identify if they have a mental health issue?
Going back to the previous question and also getting into this one, awareness, I think, is a very big factor in not only identifying mental health problems, but also preventing them. The more somebody grows closer within themselves to try to understand why they react the way that they react, or what triggers a certain response, and then just being aware that these triggers can come randomly in the world that we live in, that helps in at least knowing what to do when something happens, or at least having a better idea of how one can react, and then what steps one can take to mitigate some of the effects of life sometimes.
Mm-hmm.
Going off of that, also, I think people should be doing check-ins, like Jose saying, check in to see with yourself. Hey, am I sleeping a little bit less? Am I sleeping too much? Am I, getting really moody all of a sudden out of nowhere? Am I 1 minute super happy and the next minute I'm super, super depressed and sad and I don't want to get out of bed? Have I been feeling anxious a lot? Am I jittery? Am I pacing a lot more? Is it hard for me to rest or relax? Am I afraid of things all of a sudden? Am I afraid to leave my house? Am I, afraid to talk to people? Or why am I feeling this way or negative? Why am I questioning my actions? Kind of just asking these questions about, is this normal for me?
If someone is worried about their family or friend, what can they do, or what should they do?
There's all sorts of things that people could do. The question is if the person that's being asked is willing to understand and accept the perhaps observations from other people. Observations are very important. The way that somebody looks at you can be a good indicator to how one acts. And talking, I think, is a very powerful tool. Being open to understanding and listening, talking and having the ability to listen and really try to understand what somebody's going through in the context that they're going through it. That can help at least motivate to perhaps I might benefit from talking to somebody or seeing somebody to help resolve some of the problems.
What support is out there for anybody that is going through a mental health issue or problem?
So if someone that you love or care about needs support, we now have this new number that they can call. It's 988, and it connects you to the suicide hotline right away. It's kind of like the 911 version for mental health. Here in South Florida, we have 211 as well, that connects you to the switchboard of Miami. You can speak to a counselor live. You know, the counselor will speak to you and provide you services on the phone. I think those are the most direct numbers that they have. And for aftercare, they can best refer you for treatment.
For somebody that does seek support, what can someone do if the support that they're looking for doesn't help?
Well, it's difficult to address mental health problems alone, although in the end, the person that's going through the problems will have to make decisions on their own to how to address their problems, where to get help. And sometimes it might be hard to find a guiding voice or direction to find the help that one needs. So being like learning more about the resources that are available locally through 211, Google, helping yourself and learning about emotions as much as we know about them at this point in time. Education, information, that helps because it gives options.
Mm-hmm.
I think that if someone that you love or care about doesn't want help, the best thing you can do is listen. You can validate, you can ask them questions, explore what their options are, and encourage them to take care of themselves. Like, hey, I noticed that you've been feeling really anxious lately. Is there anything I can do to make it a little better? Just how can you be there and support them?
Do you think, and if so, why is there a negative stigma surrounding mental health and illness? There's still a stigma. Do you feel like there's still a stigma? And if so, why do you think there's still one?
There is definitely still a negative stigma around mental illness. I think that it's because there's such a misunderstanding and fear about what mental illness is. Especially because the media often portrays people with mental illness in such a negative way. And then that same stigma is so dangerous because it can keep people from getting the help that they need.
Mm-hmm.
And these are core issues that people go through, right? It might be difficult for somebody to talk about with anybody else or to even express. And that kind of it leads to hesitation, which is understandable, but suffering in silence is very difficult to overcome and even get out of the mindset of nobody can help me, I'm on my own.
Mm-hmm. What can we do as a community to break down those barriers?
Practice openness, I think, in general. Not just as a community, but each individual in that community. The more the individuals practice it, the more the community learns how to open up. Because you start learning on an individual level, and then you transfer that into any other community organization, community support, community networks. Openness and listening and empathy, all these are skills that can help reduce the stigma and encourage people to get proper help when needed.
I think that what we can do is to really educate the community. As counselors, it's our responsibility to go out there and talk about mental health issues and why it's so important to take care of yourself and do these check-ins and I think that what you're doing is also really helpful in breaking down that stigma, because you're bringing this information to the community. Um, so giving people in the community access is
Yes.
super important.
Do people of color and minority groups suffer from mental health illness more than other groups?
Yes, not necessarily because of a difference in mentality or uh, brain structures or functions. I think that's due a lot more to just the difficulty in accessing care that can come, and uh, understaffed agencies, over referrals, and just stress in general can affect people of color. People in general are affected when there's a limit to the services they can receive, to even the location of where the services are. Traveling like 45 minutes to get to an agency might be just not possible for somebody who can't drive or takes public transportation. So I think it's associated a lot with socioeconomics, with culture, with a lot of things that kind of compound on each other to enhance the rates of mental illness, the rates of suicide, trauma, depression. All of this increases when there's limited access to appropriate resources and help.
So there's definitely a disparity as to who has mental health access, like Jose is saying. And they're very serious and persistent in our society. I think that a part of it is also that we need more training within the universities. The providers themselves need more education regarding how to bring the gap, make it smaller so that people have access and provide more openness in how to treat people who are of a different race or a different color than you, of a different culture. For example, more African Americans are diagnosed with schizophrenia rather than depression. Why is that? Why is it that, there is that disparity in diagnosis? Why are we so quick to give such a harsh diagnosis to somebody who will have and carry this diagnosis for the rest of their life and have the stigma with this label as well? I think that, like Jose was saying, minorities have less access to mental health services than Caucasians. Why is that? We have to ask our society these questions and kind of bridge the gap.
Yes, and that's one of the things that I love about the work that you guys are doing at FIU, at the College of Medicine, especially with their students, and really engaging them in a wide variety of specialties and letting them learn so that they're well-rounded physicians when they go out into the world. I love that. I wanted to ask, do you think we're seeing an increase in mental health crisis due to COVID or since COVID? And if so, why?
Definitely. Isolation has been a big factor in it. Not interacting with people as we normally do was a very big change from one week to the next. That increased domestic violence, depression, isolation, substance use. All these things just came hand in hand with COVID, and now we're seeing the effects of that 2 years later. Now we start to see how all that really affected. In the moment, perhaps we were going through a pandemic collectively. Now that we're coming out of it, we're able to kind of better see what the effects of all that was.
So I think that there's definitely an increase in the mental health crisis due to COVID, not just because there's this fear of this illness that could kill us and our loved ones, with the added stressors that we're seeing, financial stability, rent has gone up. People are having a hard time finding employment that's stable. There is a huge food insecurity. The price of food has gone up exponentially. I was looking at even the prices of a hot dog has gone up like 10-20% in the last few months. So I think that all of these are adding to our stressors and our anxieties. There are children now that are orphaned. There are parents that have lost their children, don't know where to go. There's this collective grief and bereavement that we need to process as a society and acknowledge from, before it becomes a complex situation and it turns into depression. I think that one of the only good things that COVID has done is develop kind of like why do we need mental health to begin with? Why do we need to focus on educating the community? And why do we need more counselors out there in the world? We need it because of this reason, and other, mental health issues that might arise.
And do you think we are seeing an increase in mental health crisis in children and teens? And if so, why?
Oh, yeah, for the same reasons as the pandemic, but also the added, I think social media is a very big influencer in mental health and mental illness and self-judgment, FOMO, all this is very impactful to minds that haven't really learned how to function in the world. Children and teens are finding out how to be adults. They're finding out how to live their life, what life they want to live. And when there's so much information in an instant at any time from multiple different sources, that can lead to confusion, and managing screen time is a very important lesson for children, teens, and adults.
I think that there has been an increase in mental health crisis for the same reason. It's mainly due to social media that we've seen an increase in depression and suicide, social issues. The kids nowadays have more access to things that we ourselves were not exposed to at the beginning of this century. We didn't have this pressure, and if you've seen these filters that they have that are impossible standards to meet, the role models that they're looking up to. I'm just gonna kind of bash the Kardashians here a little bit, where you lose 16 pounds in a week because you want to fit into a certain dress, and the importance of how you look like matters so much. And that's not reality. That's if you got money, and if you got things that other people don't have. We have exposure to the news. How many kids are opening up their phone and you have those notifications that tells you, oh, look, another shooting happened. It's affecting their sense of safety. And you're seeing more and more tragedies. You're seeing more situations like the ones in Texas and Parkland. We're seeing more bullying online. People can be so harsh when they don't see the other person and their reaction. It's so easy when it's anonymous to hurt the other person's feelings. And of course, during the pandemic, we had this, we had less interaction face to face. So our kids have also lost the ability to socialize. And there's a lot of social awkwardness out there. And so they feel judged and they question, and why did I say the right thing? Did I not say the right thing? So, their inner voice is kind of hurting them.
Thank you. So all of this information is really good, and I really appreciate you guys for coming on and talking with me today a little bit about mental health and what that looks like, the resources that are available to them, and who they should look to seek assistance. I really appreciate you guys for that. I wanted to ask, is there anything that you guys want to tell the community about what it is that you guys do and how they can receive help from you guys if they're interested?
We work for the Neighborhood Help Program at FIU. We see individuals who do not have access to healthcare for whatever reason. No insurance, a job that doesn't pay for it, no documents to be in the country. There's so many different reasons why people need the services that we can offer. And if I was to offer any piece of motivation for parents and kids out there, or mostly for the parents, kids and teens learn through observation. So if they observe you addressing stressors, being aware or learning how to be aware and watch you think about situations instead of initially just reacting to things in whatever way. That is a great source of information that you're offering kids without even giving them information. You're just offering them the opportunity to see you handle things. So that's what I would offer to families.
Thank you. That was really good advice. Any advice?
I agree with Jose that parents leading by example is super important. But I think that parents with all this new pressure need their own support. A lot of the times when parents come to us, they're like, fix my child. My child has, depression and they have a problem. And they don't realize that maybe the child is feeling that way because they're seeing something in you that they feel like maybe you need more support and you need someone to talk to. And they're feeling like maybe they're to blame for the issues that are going on. There's a lot of internalizing about that. I'm, not to go into any details, but I'm currently working with a teenager who felt the need to get a job really young because he felt that I need to help my parents. They need more help than I do. And they want to become grown-ups faster because they see their parents struggling and suffering and they want to help. So I think a lot of it is also, where do the parents go for their support? Where are they going for help? And a lot of them turn to religion and comfort and prayer, and that's great. But maybe you need a little extra. Where can we help? And that's where counselors can bridge the gap.
Thank you. That was really good information. And I really appreciate you both for joining me today for our Wellness Wednesdays and providing education to the community. It was really good.
Thank you so much. We're looking forward to the next one.
No
We'd
problem.
love to be out in the community.
Absolutely. Thank you, everybody.